Hello, I'm Congressman Ted Lieu. I'm here with Dr. Shai Roy, and we're doing an electronic healthcare town hall. I'm very excited to have Dr. Roy here with me. He is actually going to be the youngest incoming president of the Los Angeles County Medical Association. I'm going to give you a bit of background about Dr. Roy, and then we're going to answer questions. We have some questions that came in earlier. We'll be getting additional questions, and really look forward to talking about healthcare. So Dr. Roy is a cardiologist in the LA area, and he is also a trustee of the California Medical Association. Dr. Roy graduated from Johns Hopkins University and the Medical College of Virginia, and has trained at Georgetown University and Harvard UCLA Hospital. He's been in practice for 5 years. Dr. Roy's research interest is cardiac CT imaging, and he's been a longtime public health advocate and has successfully advocated to increase Medi-Cal funding and to improve healthcare access. Thank you, Dr. Roy, for being here.
Thank you very much, Congressman Lieu. Appreciate you inviting me to be part of this.
So we are doing this healthcare town hall because people's healthcare rights are under assault by their current administration. They are trying to eliminate healthcare coverage for people with pre-existing conditions. They have tried to sabotage the Affordable Care Act. So we're going to get into some of these issues as well as answer any questions you may have. So I thought we might just start off with a question we've already received, which is Christina from Rancho Palos Verdes wrote, and she asked and stated that she is very concerned with the possibility of the Trump administration's attempts to do away with the pre-existing conditions protections in the Affordable Care Act. She's been a family nurse practitioner for 20 years and has seen what happens to patients when they do not have adequate health care coverage. So when we just ask this very basic question, Dr. Roy, what is classified as a pre-existing condition?
So pre-existing condition can be any number of things. Very commonly things like history of cancer, history of heart disease, things that HIV, which is a chronic illness now in 2019. Those are the types of diseases that really make an impact in terms of patients trying to seek insurance coverage with those types of conditions. And the things you have to think about are, for example, a history of cancer. So obviously that changes your life. That once you're a cancer survivor, that's cancer is something you have to live your entire life with. You never want to be in a position where you may be denied coverage because of something that you've been through and survived, and something that you'll spend your entire life fighting. And the Affordable Care Act really was effective in terms of enforcing that necessity for insurance companies to not deny patients the ability to have insurance because of a pre-existing condition like that.
So would diabetes also be something could be considered a pre-existing condition?
Absolutely, yeah.
So this could be quite a lot of different medical conditions that most people or their families might actually have.
Absolutely, diabetes, very common, very prevalent in our country. Even things like hypertension or high blood pressure. As people age, they get chronic illnesses, and so these are things you should be totally focused on treating those chronic illnesses, not worry about whether insurance companies cover them.
So before the Affordable Care Act, insurance companies could just flat out say, we're not going to cover you if you have a history of cancer. Am I understanding that correctly?
Before the Affordable Care Act, they could either deny you coverage or set up a coverage plan that is just so dramatically expensive that it's not real insurance coverage, which happened often.
So in those cases, what would happen to someone who had cancer and couldn't afford it? They would essentially, I guess, just die slowly, basically?
You would, many of those patients would get undertreated. So often what would happen is patients wouldn't get the outpatient treatment that they needed, because that's really where the crux of the most important coverage is. And so patients may, with these types of chronic conditions, may not get the outpatient treatment. So they will get sicker and sicker until they require some sort of emergency treatment, inpatient treatment. And so clearly that's bad for the patient, but that's also bad for the healthcare system in and of itself, because the highest costs and the real costs in the healthcare system are in emergency services, inpatient services.
Thank you. So we have a question. Jake from Facebook has asked, what is the plan on getting a hold of the unaffordable and constant escalation of prescription drug prices and the extremely high prices of new drugs coming to market? And will this plan actually pass both the House and Senate and then get signed by law and by the president into law? So that's a great question. Let me first conclude the last question, which is the reason we're talking about pre-existing conditions is right now the Trump administration is suing in federal court to eliminate the law that guarantees health care coverage for Americans with pre-existing conditions. And that's why we're talking about it. And that's why we're trying to fight back. The House of Representatives, the Democratic caucus, we passed legislation to try to protect people with pre-existing conditions, and we're going to continue fighting. A second issue is how do we lower prescription drug prices? So Jake from Facebook asked this very good question. So let me talk a little bit about it, and then I'll ask Dr. Roy for his thoughts. So the House of Representatives, the Democratic caucus, we have passed a number of bills to lower drug prices. Now, one of the things we found is that if you introduce generic drugs into an area where there are existing drugs, you can lower drug prices by sometimes over 50%. However, some of the drug companies have engaged in very bad practices that were preventing generic drugs from coming onto market or delaying them for many, many years before they could come onto market. We passed a package of bills to speed up the process to prevent these bad practices from happening. So let me ask you your thoughts about prescription drug prices, how we might lower them, and your view of generic drugs in general.
Sure. So I mean, just stepping back, I mean, the cost of prescription drugs in this country has doubled over the last decade, reaching almost $300 billion. The cost of the most commonly used brand name medications has gone up by 164% between 2008 and 2016. So physicians in California, physicians across the country, concerned that patients can't afford the necessary medications that they need to improve their health, and then this may cause them to delay or altogether forego filling their prescriptions at all. 1 in 4 patients report that they or a family member didn't fill a prescription within the last year because of cost. 1 in 4 cancer patients reported that they did not fill a prescription within the last year because of cost. And so that's a remarkable, in our, in our country, in a country like ours, that's a remarkable statistic. And if you may, my late brother-in-law, he was a severe hemophiliac. He was chronically ill with severe hemophilia his entire life. It was financially crippling to my wife and her working class family. He had a huge financial burden on while she was growing up. Even on disability with Medicare. So he got disability with Medicare to cover his, because of his severe hemophilia. My wife's family had to take out a separate private insurance plan to cover the cost of his IV infusion. Okay, so his IV infusion with blood products that he needed for hemophilia cost thousands of dollars a month. Medicare at that time had a 20% copay for drugs. Okay, so if you're, depending on how much your monthly drug cost is, obviously it can vary. So if your drug costs are thousands of dollars a month, that 20% really is a huge burden for working class families, for lower income families. And so they were able to work to try to get another private insurance plan. And so they had 2 separate insurance coverages. But they were, they lived my entire wife's growing up. They lived month to month, year to year, trying to fight to make sure that that Dennis got the coverage that he needed. And he knew many people that were hemophiliac and with a similar burden, their families, they themselves couldn't afford, that extra coverage, and so they were either didn't get treated or were undertreated. And so this is one disease state, one family. This is true in every geographic location, everywhere in the country, and these stories are all too common.
Thank you. So I want folks to know that the Democratic Caucus in the House of Representatives, we've passed a lot of bills to move America forward, to protect Americans' health care, and it's all getting bottled up in the U.S. Senate. And it's not just health care, it's pretty much every bill we passed out. So for example, we passed the Violence Against Women Act reauthorization with bipartisan support. Mitch McConnell in the Senate has not allowed that to be taken up. We passed, for the first time in over 25 years, gun safety legislation, including background checks, universal background checks on guns. I view that also as a health issue. Senator McConnell will not allow that to come to a vote. We've passed the Equality Act, bipartisan support. Senator McConnell will not allow that to come to a vote. So we have to continue to pressure the Republican-controlled U.S. Senate to at least get them to take these votes, because once they take these votes, I think a number of these bills will pass. We passed a package of healthcare legislation to reduce drug prices. My hope is that with enough pressure, the Senate will take up those bills. So let me move on to another issue. This person wrote that he was shocked when an emergency landed his wife in the hospital, and when he got the bill, even though this was an in-network hospital with his health insurance, that he got this huge, massive bill because some of the folks who treated his wife were out of network. Can you explain, first of all, what this issue is and how this arises?
Sure. I mean, so one of the, a patient or person may be insured, okay? And so just to give you a real life example, so they may be insured, they may have some sort of a condition that requires them to go to the emergency room. Let's say they have some abdominal pain and they need an appendectomy. They go to the emergency room, they end up needing appendectomy. That emergency room, the hospital services may be in network, but the anesthesiologist, for example, may be out of network. And so, in a great clinical situation, hopefully that patient will be taken care of, get their appendectomy, and then when they go home, days, weeks, or months later, they may get a bill because that singular person that was part of the bigger treatment team was out of network. And so they may get this big, unexpected bill, and that has, that can lead to a huge financial strain, has led to bankruptcy in the past, and it comes in between the physician-patient relationship.
I worked on this issue when I was in the California State Legislature, and sometimes what folks don't realize, and thanks for that explanation, is that when you go to an emergency, let's say you even have surgery, whether it's emergency or scheduled, there are a whole bunch of folks who work on these cases that you may have no relationship with. So for example, maybe you get your blood tested, and the doctor who looks at that blood test may be out of network. You have no idea, you have no relationship with the doctor that looked at the blood test, and then you're hit with this whopping bill from the lab. And so we're trying to work on these issues. There are two bills currently being worked on in the House of Representatives. One is called the Protecting People from Surprise Medical Bills Act, and that's being drafted by Congressman Raul Ruiz and Congressmember Ami Bera. They're both doctors, and it's also bipartisan with Republican Congressman Larry Bucshon and Brad Weintraub from Ohio, who are also working on it. And then there's a second bill called the No Surprises Act, which is being drafted by House Energy and Commerce Chairman Frank Pallone with his Republican counterpart Greg Walden out of Oregon. So we're working on this issue, and we expect this year to again pass this out of the House of Representatives. Hopefully the Senate will take this bill up. Okay, so we have another question where this person wrote in, and she was raising concerns over recent efforts in different states to limit or eliminate a woman's right to choose. So we've seen some pretty extreme bills that have been signed into law in a variety of these states that would take away the woman's right to choose. And what is your view, first of all, of in terms of the health effects of what would happen to women if a bunch of states started doing that?
Yeah, and thankfully in California we live in a state where a woman's right to choose is protected. And so we've seen many of these bills go through in other states, and they restrict women's access to choice, to abortion, and that can absolutely endanger a woman's life. That can cause undue financial burdens on a woman, and it comes between the physician and the patient. These types of issues are best discussed between a physician and a patient, and so California physicians are certainly united against the types of laws that are being passed right now.
Thank you. And didn't the administration recently take an action that would make it harder for researchers to rely on fetal tissue for looking at treating diseases and other conditions?
Right. So the administration very recently, in the last couple of weeks, restricted the use of fetal tissue for scientific research. And I know that California physicians are united in saying that those types of decisions should be scientifically motivated, not politically motivated. And so what is done for scientific research should be based on science, not on politics.
Okay, very good. So I have a question related to your practice in cardiology. So I read recently an article that said, hey, maybe folks actually shouldn't take a low-dose aspirin, because that's been recommended before. What is your sense of that issue?
So it's gotten very, very complex, so and the guidelines have changed several times in the last decade. And so, for folks out there who are on a baby aspirin or considering taking a baby aspirin for their heart health, I would absolutely tell them to bring that up with their primary care physician. And so, because it is very complex, and it depends on your age. Now it depends on some of your other comorbidities. Now there's actually some other medications out there that may be more effective than aspirin as well. And so the science has gotten very complex, where you can no longer prescribe patients of a certain age to be on a baby aspirin. And Congressman, you look too young to be considering any of this stuff. And so, but I would encourage people to really talk to their physician about it, because the science has evolved.
Okay, very good. So as we sort of look at the healthcare landscape, the Affordable Care Act is still the law. The attempts by the administration to get rid of it has not in fact happened, but they did get rid of their mandate for people to purchase insurance. Has that had an effect, or a lot, not a lot, or what's your sense of how that's gone?
Absolutely, it has and will have an effect. And I just want to really praise you, Congressman, for your support of restoring and enhancing the Affordable Care Act. One of the best ways to achieve universal coverage for all Californians, for all Americans, is to make improvements in the ACA. Since the enactment of the ACA, California has led the nation in expanding healthcare coverage. More than 6 million Californians gained insurance after the Affordable Care Act came into play, and our uninsured rate declined from 17% to an all-time low of 7%. And so I know that the U.S. House has recently restored important provisions in the ACA that would continue to ensure coverage for patients with pre-existing conditions, you know, prescription drug legislation as well. Specifically, the individual mandate. So the individual mandate is absolutely necessary. The Affordable Care Act not only ensured universal access, but it also it's important to keep premiums at as low as possible. Without the individual mandate, where you have healthy people in the pool, that's going to artificially raise, that's going to raise the premiums on all Americans. And so having that individual mandate is very, very important to make sure that Americans have lower premiums that they can pay.
Thank you. So because of what the Trump administration did, we in fact are going to see higher premiums because particularly folks who in the past had to buy health insurance, now they're not going to buy health insurance. That's going to increase costs on everybody else, particularly when those same folks then get into an injury or have to go to the emergency room. Those costs will be passed on those who do have insurance. But we are fighting back. So the Democrats introduced in March of this year HR 1884 called Making Healthcare More Affordable Act. And this will go ahead and work to reverse the Republican sabotage. Okay, so we have another question that came in. Janet asked, what are you doing to lower healthcare premiums? Okay, so following up on what we just said, we are fighting to lower healthcare premiums despite the sabotage by the Trump administration. So let me go into some specifics on HR 1884, the Making Healthcare More Affordable Care Act. What this is going to do, it's going to lower health insurance premiums in the marketplace by strengthening tax credits to help lower premiums and also allow more middle-class individuals and families to qualify for subsidies. Second, it will ensure that families who don't have an offer of affordable coverage from an employer can still qualify for subsidies in the marketplace. And third, it provides funding for reinsurance, which will help with high-cost claims and bring down premiums. So we're trying to lower premiums, and I just wanted to see if Dr. Roy, you have any thoughts about other ways we could try to lower healthcare premiums?
Sure. I mean, I just want to reinforce some of the things that you're talking about. The ACA reinsurance program is critical. That's basically the government insuring insurance companies for catastrophic claims, the really, really high cost claims. And it brought down premiums with the Affordable Care Act by 10%. So that's a huge, huge sum of money. And then just to expand premium support for people above the 400% of the federal poverty line, just to lower, lower premiums for low-income families, continue cost sharing reduction programs, really restoring a lot of the things that the Affordable Care Act did to help low-income families afford their premiums.
Thank you. So some things I think folks might not know about the Affordable Care Act. In addition to slowing the rate of increase of premiums, the Act also did a lot of things for people who normally get the health insurance through employer-based health care coverage. The Act wasn't just applying to folks who did not have insurance, it applied to folks who already had insurance and made that insurance better. It did that in a number of ways. First, it eliminated the ability of insurance companies to impose coverage caps. So in the past, insurance companies could have annual and maximum coverage caps that basically said, hey, if you spend too much money because you got a cancer diagnosis or some other diagnosis causing a lot of medical bills, we're just going to stop paying. And in the past, they could do that. Now they cannot. They cannot impose any coverage caps. Second, it allowed children up to the age of 26 to continue to have health care coverage through their parents. And then third, it prevented things like junk health plans from being offered. And so I want to talk a little bit about junk health plans, because the administration is now pushing these junk health plans. It's true, Dr. Roy, right, in the past that you could get these health plans where you think you're getting coverage, and then it turns out you only get coverage if you have a scheduled medical visit, not for a emergency room visit. Or it turns out that you have to pay this massive deductible. Is that true? You have these junk health plans?
Absolutely, and unfortunately, in terms of the way that politics works in DC right now, this is how people are using these junk healthcare plans to say that, oh, people with pre-existing conditions are still going to get covered. So, for example, let me just give you a story. I have a friend who was diagnosed with liver cancer when she was in the 70s when she was a baby. So she got, she was one of the few babies at that time to survive with hepatoblastoma. And she got surgery, she got radiation treatment, and then she was a cancer survivor at a very, very young age. In 2010, right before the Affordable Care Act really took place, it went into law and went into the marketplace, she got diagnosed with gastrointestinal stromal tumor. And so that's a gastrointestinal cancer that's probably related to the radiation treatment that she got as a baby. So after being a cancer survivor for a few decades, she got diagnosed with this new cancer, and she had a young baby at that time. And so she had private insurance that she had purchased outside of her employment, and she was able to get the treatment that she needed. So she got surgery, chemo, radiation, and she went into remission, cancer-free. Great news. When the Affordable Care Act came into play, she was able to purchase insurance off of the exchange so that she could afford her once-a-day chemotherapy drug, once-a-day chemotherapy pill that she'll have to be on for the rest of her life to help prevent recurrence of that same cancer. Now, with these attacks on insurance companies for patients with pre-existing conditions, she has to live with the fear that one day she won't be able to get coverage through the exchange, and she'll either not be offered an insurance plan or she'll be offered a junk insurance plan where it's so expensive, the deductible is so high that it's going to be unaffordable for her. And so, she is living with this day-to-day, month-to-month. She should be fighting her disease. She should be taking her pills, living her life, but instead this underlying background of stress and anxiety because of the financial burden of fighting this disease exists. And so these junk plans are really a burden.
Thank you for sharing that story. I should tell you my story of why I got so passionate about healthcare. I was in the state legislature, and it was in the state assembly, so it was early in my career in state legislature. And I remember I was at a restaurant, and this waitress came up. She realized she knew I was in the state legislature, and she asked for help. This was before the Affordable Care Act was in existence. Her daughter had just turned 18, and so at the time in California, if you had no minor children, you could not get government health insurance. So she had a prior pre-existing condition. It was actually a heart-related condition, but it had been solved. But despite that, the insurance plans viewed that as pre-existing condition. She was recently diagnosed with breast cancer, and so she could not get health care coverage. And I realized after her story that we have these structures set up in society where if you got very sick, like the emergency room, you could go and get health care coverage. Or there are places like the Venice Free Clinic, they do amazing things. They don't treat cancer. And in my view, she was basically going to die slowly. And then one day, she would get sick enough to go into the emergency room. They'll treat her for a while, and then she'll die. And I thought, in a country with the vast resources of the United States, this should never happen. And so under the Affordable Care Act, that will never happen again because she can get health care coverage. So that's why I'm so passionate about healthcare, because we're talking about an issue of life and death. So we have this question that came in, John from Santa Monica, and he said, what have you heard from patients about the uncertainty around healthcare? You have this lawsuit with the administration trying to eliminate the entire Affordable Care Act. You hear stories about insurance companies and junk healthcare plans and people not knowing what they're getting. So what are you hearing from patients in terms of healthcare?
I mean, in addition to just the sort of theoretical anxiety that creates, the uncertainty is real. The patients are I've seen it in the last year or two. You know, patients, more and more patients are getting dropped from their insurance plans or changing insurance plans based on some of this uncertainty. And what happens is, anytime there's lapses in coverage, or changes in coverage, that creates a really tough situation for patients to get optimal treatment, and also for physicians to give optimal treatment. Just the other day, just a couple weeks ago, I saw a patient who lost his job a few months before, so he lost his insurance coverage. Couldn't afford to pay for a plan on the exchange, and his Medi-Cal was still pending, and so he lapsed all of his medications. He just stopped taking all his medications because of the affordability issue, so including his critical water pill. When patients have congestive heart failure, they get among the many other pills that they're on a water pill to help them get the fluid out of their body. So he comes in 30 pounds overweight after not having his water pill or any of his other medications, and this is entirely preventable, and it's just totally due to the uncertainty in the insurance market, and so this creates real life problems on an everyday basis for patients of every socioeconomic class in every geographic part of this state and this country.
Thank you. We want to take one last question, and this came in. Tommy from Torrance wants to know, how do we as constituents and citizens make sure some of the legislation that's been talked about gets passed? So that's a great question. So I'm going to talk about and conclude, and then I'll have you give some concluding remarks. So my view is that President Abraham Lincoln had it right when he said that public sentiment is everything. With it, nothing can fail. Without it, nothing can succeed. And I want you all to understand your power to shape public sentiment. For example, you can call your legislators, whether at the state or federal level. You can call Mitch McConnell's office. He is the Senate leader, purportedly for all Americans. You can call the White House. During the whole Affordable Care Act battle last term, the White House got so many calls, their lines got shut down. And I can tell you that has an impact because the administration realizes how many people care about protecting health care. In addition, social media is free. If you do a viral post on Facebook or Twitter or another social media platform, maybe you can influence someone in Kentucky or Florida or Ohio. And I also think about writing letters to the editor. It turns out that papers, for example, like the Washington Post, the New York Times, the Los Angeles Times, they do get lots of letters to the editor. Also turns out many of them come from the same people. So if you start writing in and you get, they get fresh new voices, eventually you'll get published. So don't underestimate your power to help shape public sentiment. And we in the House of Representatives on the Democratic side would continue passing legislation to protect healthcare, to push back against the sabotage by the Trump administration, and to reduce healthcare costs, particularly in terms of drug prices. Some of those bills are already at the Senate side, so we need to put pressure on U.S. senators to demand a vote be taken on those bills. And if you saw last term, there was enough pressure on U.S. senators that they could not repeal the Affordable Care Act. So again, don't underestimate your power to help shape public sentiment. So with that, let me have Dr. Roy give some concluding remarks.
Sure. I'm as the president-elect of the LA County Medical Association and a trustee of the California Medical Association, I'm proud to represent thousands of California physicians, and we are supportive of your efforts to lower the price of premiums for patients, to expand access to care for all Californians, all Americans, to achieve universal health care, to lower prescription drug prices. And so very supportive. And I'll just leave you with one thing that really struck me. My wife's a radiologist who specializes in oncology. And last year we were at a conference where one of the lectures was about the financial toxicity of oncology drugs. So there was a full lecture about not on side effects, not on treatment plans, but about the financial toxicity of those oncology drugs. And so we live in a healthcare delivery system where us as physicians, who are scientists or healers, have to learn about those things, and we'd rather not worry about the financial toxicity of anything. We'd rather be able to treat our patients in the best way so they can live the longest, most quality, healthiest lives they can.
Well, thank you for being here. Thank you for your public service, and congratulations again on being incoming president of the Los Angeles County Medical Association. I look forward to working with you as we improve healthcare for everyone in Los Angeles County, and I really appreciate you being in this town hall.
Thank you very much.
Thank you all for watching.